she comes to a lot of the Board of Supervisors meeting detailing scientific knowledge that most of the board members have not even thought of, detailing the methods of testing that are fraudulent, that are not what they should be doing. And you know, I told her, I mean, I barely understand what she's saying. My husband's a scientist, so we go home, he explains it to me. And I told her that maybe when she gave her speech here today that she needs to dumb it down a little, you know, so I didn't mean that as an insult to you, but just we got to average it out. And so not only does she attend the Board of Supervisors, she attends City Council, school board meeting, goes to rallies. She's part of a group called Stand Up San Bernardino. She's also the executive director of Educate, Advocate. And they serve families who have children and adults with disabilities and special needs. And she is just a powerhouse. I'm so glad we met her. We met some other people in the lobby too, and they're here, right there. Wave your hand. And we just hang out there and we meet wonderful people who we never thought would be on our side, and here they are. So, Christy.
Hopefully the presentation will be up soon. As Jack mentioned, I'm from San Bernardino County and also Educate, Advocate. Hopefully, yes, it'll come up right now. We have a Facebook page, Twitter, Instagram, and we're on Telegram for Educate, Advocate. And what I'm going to talk about today is PCR testing, the basics for COVID-19 cases, lockdown, quarantine, the tier system, and tyranny. Okay. So PCR tests is exactly what everything is based on, our whole tier system in California of the reopening plan that the governor has in place for us, and the Department of Public Health. PCR stands for polymers chain reaction, a method to analyze a short sequence of DNA or RNA, even in samples containing only minute quantities of DNA or RNA. It's used to reproduce or amplify selected sections of DNA or RNA. I had a video, which hopefully you guys are going to get a copy of this presentation. You can click on it because unfortunately there's not Wi-Fi to be able to do this, of the inventor of PCR, which is Carrie Mullis, who went over the fact that you could use a PCR test at a certain amplification cycle threshold to come up with anything, even if it's not there. So it's a really important video to watch because he is the inventor of it. It came out during the AIDS, HIV time, and he passed away at a relatively young age, just a few months before COVID. So, if you can bring it up. She had told me. Okay, that's okay. No. All right. Another really important thing to keep in mind was that the New York Times covered this very interesting issue with the PCR test back in 2007. And the article was called "The Epidemic That Wasn't." And there's a link here in that. And basically what happened was this hospital thought they were having an outbreak of pertussis, and they did this through PCR testing. Come to find out, it wasn't pertussis at all. And so what she says at the very end, Dr. Kathy Petty, she says that the story had one clear lesson. The big message is that every lab is vulnerable to having false positives. No single test result is absolute, and that is even more important with a test result based on PCR. So this happened in 2007, and it's happening again. In July of 2020, there's another YouTube there that I suggest you link on, because it takes you right to the video where Dr. Fauci says these very words. If you get a cycle threshold of 35 or more, the chances of it being replication competent are minuscule. He goes on to say you almost never can culture virus from a 37 cycle threshold. And then, so you gotta say, if someone comes in with 37, 38, even 36, you gotta say you know it's dead nucleotides, period. That's gonna be important to notate. So keep in mind those numbers. You know, anything over 35 and over, there's nothing really there, okay? That's really important. The next thing on this slide is the document put out on the CDC on an FDA website in July 2020. And that also goes on to say that if you go up to the 40 cycles, that's problematic. And of course, the majority of our labs are doing that cycle threshold of 40. And then the Houston Health Authority, I have a quote in there from him as well, where he talks about, so the higher the number, the less virus there was in the initial sample. Some labs will report out to 40 cycle thresholds, and if they get a positive at 40, which means there is a tiny, tiny, tiny amount of virus there, that gets reported to us as positive. So they don't have a way to say, okay, it's a positive or a negative, this is what it was. They don't necessarily, it's just yes or no. You either are classified as having COVID through this PCR test or not. The New York Times surprisingly ran a pretty good story about PCR tests. And these were some of the things that they came to discover. And one of the things they said is it's just kind of mind-blowing to me that people are not reporting the CT values, which is the cycle threshold value from all the tests, that they are just returning a positive or negative. And the standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. Yes. And these non-contagious people may contribute to bottlenecks that prevent those that are contagious from being found in time. So you can review that article there, there's a link there, but those were some of the important quotes from the article. Okay, so this is getting to the nitty-gritty with our county. So we went to several meetings. We expressed that we wanted to know what are the cycle thresholds of the labs in San Bernardino County that they're running. And so nothing worked going to them and asking them for this information until we kind of put a threat out to them, which was, you know, we're going to meet with you guys individually, and then all of a sudden we got an email from the public information officer through the county with the information. And this is a summary of all of it, and you don't really need to know all of that. All I would want you to pay attention to is the cycle threshold. And keep in mind, this was effective, the date the email was sent was January 11th, 2021. That's gonna be significant coming up later. But as you can see, the lowest one is LabCorp, and it's 38. And what did Dr. Fauci say? Anything 35 or above is not valid. So here you have 40 to 42. Fulgent, which is under a state contract with our county and the state, just said less than 40. How nice and convenient that they can somehow later say, oh, it was really, 25 or whatever. as we're dramatically going down in numbers all of a sudden. Very interesting. Okay. So what does it mean? Our PCR tests are under emergency use authorization, just like the vaccines. They're not approved, they are authorized under emergency use authorization, okay? It's supposed to be among those who actually have symptoms, not people that don't have symptoms, AKA asymptomatic, or AKA healthy people. So no PCR test has been approved or authorized for anyone who is asymptomatic and not knowingly exposed. Yet our governor and CDPH, their metric for getting the county to move along the color tier system is that you have to test. You have to test lots and lots of people. The emergency use authorization is supposed to be for those who have symptoms of COVID or their doctor suspects they might have it. So, but yet, as you all know, there's mass testing going on at pop-up clinics. That's kind of slowed down a bit because of the vaccine rollout, but still, that's the way it has been for some time now. On the fact sheet for the PCR tests, it basically gives a summary of why you would get a test. And as you can see, if you're testing asymptomatic people or people who have no symptoms, you're not keeping in line with any of these standards that they have up here. Because you wouldn't have a fever, cough, difficulty breathing if you don't have any symptoms. So that's not keeping in line with that. And then I bolded some of the pertinent parts. These are agreements with the labs. So there's labs that are approved for doing the testing. And these are the important parts to say. So they're saying we're agreeing that these are the people that we would test and no one else. So obtained from individuals suspected of respiratory infection consistent with COVID-19 by their healthcare provider, collected from individuals suspected of COVID-19 by their healthcare provider, and then there's a really long one down here too. But as you can see, the vast majority of these authorization agreements, emergency use authorization agreements, say that you have symptoms. That's what they're agreeing to do, not test just anybody. And then this is just a case that happened in Portugal, and they were trying to quarantine people, and basically the court ruled that that's unlawful. So it's a good one to point out. That just happened in November of 2020. A study came out in December 3rd of 2020, and in the conclusion, it states that complete live viruses are necessary for transmission, not the fragments identified by PCR. Prospective routine testing of reference and culture specimens and their relationship to symptoms, signs, and patient cofactors should be used to define the reliability of PCR for assessing infectious potential. Those with high cycle thresholds are unlikely to have infectious potential. So once again, pointing to, you guys are using too high of cycle thresholds, that's problematic. These people don't really have COVID. Florida also made the decision to say that we need to have the cycle threshold. That when you're reporting numbers out, we need to know what the cycle threshold is, which is good. I wish our state would do the same. And then the WHO, take a look at the date, January 13th, 2021. They revised their standard to say where test results do not correspond with the clinical presentation, a new specimen should be taken and retested using the same or different NAT technology. And most PCR assays are indicated as an aid for diagnosis. Okay, so what do these two things mean? Well, first of all, what they're saying is, look, if you get a positive, you should really get another test. All of a sudden, they're saying this. And you guys notice the date, January 13th, very close to when someone was going to be put into office. So yeah, all of a sudden the standards changed. And then they're saying down here, where it says most PCR assays are indicated as an aid for diagnosis, and saying, look, you have to also evaluate the patient, not just give them a test, and then, oh yeah, they have COVID. There has to be an actual evaluation of the patient. They have symptoms consistent with being ill. So all of a sudden, a year into this almost, that's the advice they're giving. Interesting. Okay, so PCR testing in school. Kind of a dystopic topic to get into because that's where we find ourselves in the middle of right now. I don't know if you all saw the video that LAUSD just put out recently. They're proposing a common pass, which like Israel has the green pass, which they're using right now. And so, you know, they can call it all kinds of things, but basically students have to do testing, PCR testing weekly. Long Beach Unified wants to do PCR testing, and they want to use, by the way, the nasal swab. And at a meeting they held over Zoom on February 24th, the district proposed parent volunteers could administer the nasal test to students. So that's kind of frightening. And then I got an email after I had submitted this presentation that the department, I don't remember what it's called, but it's the federal agency that handles it, they approved the waiver that the state had submitted to them. So in essence, the school districts can bill Medi-Cal in order to get funding to be testing the students, the PCR testing. So I have a feeling we're going to see many of the school districts, you know, who are clamoring for money to want to go after getting PCR testing now because they have an avenue of funding coming in through the federal government. So that'll be great. And then I'm not sure what happened today because I've been busy doing virtual school for my son all day. So, but there's two bills titled the same thing, AB 86 and SB 86, links there to both of the bills. They're mirror bills in the Assembly and the Senate. And essentially what they do is it's the reopening plan for schools in California. And there's PCR testing as part of those reopening bills under certain standards. So I just wanted to point that out so you can review that. And the governor may have signed it today, I'm not sure. I don't know the latest on that because, like I said, I'm in school with my son. And this is the infamous, I just put this in here so that you guys could see, if you haven't seen it already, our lovely colored tier system that we have through the state. And all of this is, it's important to point out because all of it is based on PCR testing, okay? So that's why it's important to point that out. And as you can tell, there's no green because we're never going back to normal, except I argue now we are gonna have a green. It's gonna be called the Green Pass, which is your vaccination passport. So a couple of things on asymptomatic spread. And basically what I'm here to tell you, which I presented at the last meeting, this last week on Tuesday, is that there's no evidence of asymptomatic spread. And why we're in this entire mess of social distancing and masks and everything that came down the line is based on this theory that they put out there that there's asymptomatic spread. That healthy people walking around are able to give disease to other people. That's really what it's based on. So the largest study was conducted out of Nature in Wuhan, in China, of over 10 million people. Okay, 10 million people. They couldn't find asymptomatic spread. So there's other studies here too, and they all point out the same thing. And on our website, Educate Advocate, we have a page on face masks and social distancing, and there's also asymptomatic spread information on there as well. All these articles and more are on there. All of the science. I didn't want to talk too much about vaccines because I'm sure this crowd is very aware of everything having to do with vaccines, COVID vaccines specifically. But I do want to refer you to a Voice for Choice advocacy for information on the COVID vaccines, and just to let you know, which I'm sure you guys guys already know that they're all under emergency use authorization, and you are a part of a live experiment. The Pfizer and Moderna are mRNA technology, and the Johnson & Johnson is adenovirus. I mentioned those three because those are the current three under emergency use authorization currently. Okay, this is the important part. We have a large amount of people here, which I love. And so this is the call to action. What do we need you to do? Come to the Board of Supervisors meetings in San Bernardino. They meet normally 2 times a month, but this month they're meeting 3 times, including next Tuesday. So at 10 a.m., bring a friend, bring more friends, bring everybody you can. Give public comment. Even if you're scared, I'm out in the lobby in San Bernardino because people that don't wear masks aren't allowed in the room, except for when we give public comment. So I'm sure you'll see me out there. Say hi. If you want to wear a mask and go inside, do that. And this is the important part. Why do we go? I mean, if people aren't listening, right? They don't change anything. They keep following the directives of the state. Why do we do it? Well, this is why. We want to educate the board and the public, and most importantly, we want to put the truth on the record, because you know what? Whether it's here on earth or in heaven, there will be a day of reckoning, and these people will be accountable to someone. So, we need to go. And lastly, you can, like I said before, you can see our website, which is educateadvocateca.com. We have pages for the face mask, the social distancing, all of the science, but we don't just focus on, like for instance, face masks, the efficacy argument, because that's been hammered. And if somebody who loves face masks thinks there's one chance in a million they could save someone, well, then they'll just do it, right? So I prefer to focus on the harm. And something that I've been more trying to push is the psychological harm that can occur. We have a great video by a campaign called #SmilesMatter, and she was talking in the video about the psychological harm that's happening. And I've noticed it too. So now, when I go on walks daily, I make it a point to smile at people, but not just smile, even if they're wearing a mask or not. I say hi, and I wave. And even the most adamant person that you can tell they're hardcore mask wearers, it's almost like a reflex, like they forgot they could do it. They can't help but be like that to me. And I can tell they haven't done that in a long time. So start small. But anyway, so the psychological issue is really at play here. And we also have, this is important, tips to boost your immune system. I've had that on our page since March 13th of last year. Okay, now we've added the prophylaxis protocol, treatment protocol if you get COVID, what doctors you could see, who you could reach out to help you out. And we also have a page on schools, including, once again, let me back up. SB 277 was a bill that passed involving vaccines. And we're the only organization, Educate Advocate, that was helping students who are on an IEP in special education to be able to stay in school, because kids were trying to kick kids out of school because of their vaccine status. So now everybody's not in person in California. Now it has transitioned to, we're the only organization, disability organization, that's helping kids to be in school without a mask. So we have that going on. And we're trying to fight the PCR testing in schools issue as well. We got a nice reprieve. The Department of Education issued a letter a few weeks ago, maybe it was last week, stating that there are exemptions in the guidance for face coverings, and it doesn't preclude someone from being in in-person education. So that's great. That's on our social media. And we have videos of all of our public comment at Stand Up San Bernardino County on BitChute and on YouTube. So I just wanted to point that out to you all. And I encourage you to come. Please come next Tuesday, 10 a.m., Board of Supervisors. I want to see some of you there. Thank you.
Thank you, Christy. Right there. Now, Dr. Sam has a question or a comment.
question is Gordon Porter, is he at the Board of Supervisors, and does he answer your questions? He's the executive director of Department of Public Health, who replaced Trudy Raimundo, who's been there for last century. But she left right before COVID, and I knew her. She was pretty reliable.
Right.
What happened? So anyway, the
Yeah.
question is, does Porter answer questions?
Well, they don't normally answer the questions of the people, like during the board meetings, and in fact, when people have attempted to reach them, they will say, "Oh, I don't know, we'll get back to you." That's been the standard reply that they've done. So that's the health director.
So for those of us who are unable to make it on work days, how do they accept and read out the questions on email?
They do not read out the written public comment, but you can submit written public comment and ask that what I would do is when you write it in like an email, make sure that you send it before the meeting and say you want this to be part of the official minutes of the meeting, so that I'm not exactly sure, but they publish the minutes. They should be available, but they haven't been. But anyhow, that's a way to participate.
Do you know? Does anybody know how tall Fauci is? Well, when I was doing infectious disease at Georgetown back in the 1990 or so.
So you say you were doing infectious disease, does that mean you were spreading them or making them?
Taking care of AIDS patients quite a bit at Georgetown. So there was a collaboration, and I had my collaboration it was up the street in Bethesda. And guess who was up there? Fauci.
Yeah.
So Fauci's not very tall, and he has a short man syndrome. And my colleagues there, I can't name names, and please don't record this. Every other word is a swear word, and the data that we were using for investigative, for pneumocystis was inaccurate.
Yeah, the maker of the PCR test, there's a great video going around of Carrie Mullis who discussed Fauci and how corrupt he was. So definitely, I don't think it's any coincidence that he passed away at a pretty young age, right before this all hit. Very
I see
odd.
two people online here that want to ask a question, so let's try to move to those quickly, and we'll get on to our main speaker.
Are you aware that, make sure that I'm right, that the lab animals that were given the early stages of this stuff have become sterile? And also
Vaccines?
vaccines, they've all become sterile. And then the second thing is messenger RNA, I believe, as a cancer widower, will affect T cells. Is that correct? Maybe sound like, I mean, you're replicating RNA with synthetic DNA. I mean, it gets to be a crapshoot. So I think it will affect your immunity to cancer and other things. This is not just going to stop the bug, right?
Yeah, I don't know much about what this will mean long term. None of us know, because like I said, we're literally, if you participate in this, you are in a live experiment, and this is novel technology for vaccines, mRNA, never been used before. So, right.
I've got a couple more questions here, and then we'll move on.
It seems like primarily your focus is San Bernardino County. Do you have any information for Riverside County?
Oh, there's a great group that meets in Riverside County too. And in fact, I'm connected to an organization that's going to do a similar thing for the whole state, for each county, which we're going to call it Stand Up California. So it'll be for all the counties, for people in those counties to be able to communicate, to know who your contacts are, to do this. But yeah, Riverside is very active. They have a large amount of people going to most of the meetings and speaking out. And they've been good allowing people. San Bernardino took so long to let people actually come to the meetings in person, and they weren't reading our public comments, written public comments during the time of quarantine time or whatever. So I don't know that it falls under any one organization right now or anything like that. just, I would encourage you to show up to one of their meetings, you know? Yeah, there should be a lot of people there.
Sir, give me liberty.
Last question, make it a good one, and hopefully a short one.
I'm very curious as to whether or not if the vendor is talking about ultraviolet virus, real fast.
Right?
This is a question, I'm very cheap, you get the sun right out there outside, and 10 o'clock, and 2 o'clock at the same time, the sun is very inside.
Yeah.
And it will work real well. Just don't let your eyes look at the sun.
It's a great point, and unfortunately, this is another area that public health has been so lacking because their only tips to us for our immunity to ward off COVID is what? Wash your hands, which I'm sure none of you guys did before, right? Or to social distance, which actually, for some people, actually makes things worse because you get depressed because you're not around people and you're quarantined in your house, or you're not out in the sunshine getting the vitamin D, all of the things. Or wear your face mask, which you can check out our website to know some of the harms and dangers that can happen, including, you know, you're breathing in and out things and collecting bacteria all over your face, and, you know, you might get bacterial pneumonia. Yeah, so that, you know, that's our only tips. But
Who was that masked man?
Thank you.
Thank you, Christine.
Thank you.
Our volunteers.